Professor Fenech.
Hi, Leah. Good evening.
Good evening.
Hope you're well.
Thank you. Thank you for joining us on a holiday. Thank you very much. What are your views about the release of the lockdown restrictions starting from Monday?
Well, I think they've been highly anticipated. But just as we're pleased that we're beginning to relax, we also have to be a bit more cautious and observe keenly that we're not going to get a second spike like they have seen in Germany.
Yes.
So full marks to Chris Fern, Charmaine Gauci, and the team. They've done a wonderful job, but the people who've done the job for them are the people, the population of Malta and Gozo.
Absolutely, they've been very vigilant, haven't they?
Largely have stuck to what they've been asked to do. So this is something coming back to the sort of normality that we're used to, although I don't think we'll be quite in the normal state we were 3 months ago for a while to go. But this is a good start.
It's the beginning of the end, don't you think? It's the beginning of the end, I think. Maybe a slow beginning of the end.
I know us scientists tend to be a bit more skeptical about these things, you know. Just because one saw one day that we had no cases, people were saying that's it, it's over. It's not over at all. And the disease isn't exactly linear. You're going to get spikes. But the trend is what we're looking at. And it looks like that we might be over the peak of it, and we're on the downward trend.
What advice would you give the public relating to the new allowances of movement from Monday?
Okay. Never forget the washing of hands and the sterilization of hands. That is vitally important. Masks will show other people that you are protecting them, but you're not protecting yourself, okay? So a mask may prevent you infecting other people. So the least you expect is for other people to have the same respect that you are showing to them by them wearing a mask as well. Because a mask is there to prevent transmission, not infection.
Yes, that makes a lot of sense. I wanted to touch base with you about the Kawasaki disease that we're reading about in children. It was reported on quite a number of news portals on the Wall Street Journal, CNN, and also on the UK Guardian newspaper. I mean, without alarming people, because we haven't seen any of these cases in Malta, which is a great thing, really. But a lot of people are alarmed listening to all this. Can we have some advice, some professional advice?
Okay, let's start with saying that the problem with having a serious disease that is spreading across the world is that it naturally raises a lot of anxiety, and that's putting it mildly. And the danger is to suddenly make a mountain out of a particle of a molehill.
Right.
And there have been, we've already had the example of, 3 patients in France were treated with hydroxychloroquine and azathioprine, and they got better. Most people get better. But no, these 2 drugs were suddenly touted by no one else than the President of the United States, whereupon people who started using it said, oh, wait, it's killing more people than it's actually... So we tend to overreact, and the papers tend to over-censor.
Yes. We always hear the bad news in the newspapers, I think.
No, but we make mountains out of non-existent
I mean, I have to
molehills.
say, I mean, from what I read, the cases are very rare, and they are not life-threatening, are they?
Kawasaki disease is a disease that we've known about for 50 years, and we still don't quite know for sure what causes it, although it seems to be an inflammatory disease. There seems to be a relationship to inflammation and infection.
And it
usually
affects children. Can I ask the ages of the children that would be
up to
more
5, up to 5.
up to
It
5
can
years?
affect,
So from
yeah.
newborn to 5, right?
That's right. And there have been individual cases reported in the papers that these children who presented with Kawasaki disease happened to also test positive COVID-19.
Right.
So there may be a possibility that there seems to be a relationship between COVID-19 and Kawasaki disease.
Yes.
So basically the advice is if your children develops a fever and a rash, take them to a GP who will refer them to a specialist because of these individual cases that have been reported in at least 6 different countries.
And if in the case that they're left untreated, basically it eventually affects the heart, does it?
Yes, in future years, the inflammatory process of the arteries may narrow down the arteries so that people start getting problems with the heart circulation, like angina. So yes, but that's why, it is an extremely rare condition. But because of the heightened state of anxiety that we're all in, suddenly a fragment of a molehill becomes Mount Everest.
Yes, I've heard quite a lot of young families being quite agitated by it.
Of course,
Can we perhaps have some precautions that they could take, if any at all?
Exactly the same precautions as we've been told about ever since this thing started. Hygiene and not being in contact with people who are not in the family. That's why the schools have stopped.
So the same type of precautions that we're doing for COVID-19.
Absolutely.
Great. What about the second peak? We're hearing a lot about the second peak stage in Malta. We've seen, I've shared with you the information by Dr. Marmara, who's a professional statistician. What are your comments about it?
Well, what is obvious so far is that we seems to be over the worst of the first peak. Whether we're going into a second peak is too early to tell. Like I said, the disease pattern isn't linear. It varies from day to day, from 0 to 2 yesterday. We're still sort of bouncing along the bottom. And I think a few more days have to pass before we can tell people that we're actually heading for a second peak. But if we're heading for a second peak, then all of a sudden we'll start going back to the restrictions we've had until today.
On the whole, though, very positive news so far.
Absolutely.
Especially when we compare with other countries also.
We score beautifully against other countries. We're right at the bottom of the table. And we're doing far better than other countries. Touch wood, and that's thanks to a good Department of Health, a good Department of Public Health, a good Department of Pathology at Mater Dei Hospital, and of course all the doctors and nurses and healthcare workers.
All the team, really.
Absolutely.
And people, I have to say, the public have been very good also, really. They've been very vigilant on the whole.
In the whole they have, and they've done a great job.
Thank you very much. Thank you, Professor Fenech, once again. We'll be with you again in a couple of weeks for more updates. Thank you for your time.
Look forward to it.
Thank you.
Bye-bye.
Thank you. That was Professor Albert Fenech with an update on COVID-19, on the new children's disease that we're hearing about, Kawasaki. I hope he's put your minds at rest. The Maltese news will air at 7:30. For Net News, I'm Hogg. Good evening.